Hi everyone, I am Dr. Cheruba Prabakar, the Fibroid Doc, and this is a question I get very frequently. So let's look at it. Here are my top 3 tips to figure out whether you need to remove that fibroid. So number 1, is it causing symptoms? Is your fibroid causing heavy bleeding? Are you in pain? Have you had recurrent miscarriages because of this fibroid? What symptoms are they causing? Is it causing, or are they causing if you have multiple fibroids? So this is the first thing to figure out. Number 2, how big is it? Is it 1 centimeter? Is it 4? Is it 15? This is going to dictate a lot of your symptoms and the potential for growth as you progress through pregnancy. So this is the second thing to figure out. And thirdly, and most importantly, is where is the fibroid? Is it inside the cavity? Is it in the wall? Or is it completely outside? Regardless of the size, if the fibroid is actually inside the cavity, you will need to remove it prior to IVF. If it's in the wall, it's questionable depending on the symptoms and also the size of it. Is it 2 or is it 12? And if it's outside the cavity, you could potentially get away without removing it, again, depending on the symptoms and the size. So you have to look at all 3 of these things together. Number 1, is it symptomatic? Number 2, how big is it? And number 3, where is it? So with all of these 3 factors together, your doctor and you should make a decision about whether this fibroid needs to come out prior to proceeding with IVF. If you are a woman who is going through IVF, you have fibroids, and you are trying to grapple with these questions and get all your options out there, come and see me in the office. I am in Lafayette, California, and my website is lalmarindagyn.com, and my number is 925-744-7473. Take care.